The COVID crisis has taken a psychological toll on all of us, but teens are especially hard hit. Instead of going to class and hanging out with friends, teenagers have been banished to a life of screens, solitude, and uncertainty. School closures and social distancing have cut them off from their support networks. The risk of developing anxiety and depression is higher. Psychologists say the needs of teens are often overseen when it comes to COVID restrictions. I'm Ben Fazulin. Thanks for joining us. The struggle continues. COVID hasn't gone away. It's one wave after the next, and lockdowns become part of life for many of us. But that doesn't make it any easier. Teen mental health services are overwhelmed in countries like Belgium. DW's Rose Burchard reports.
Long months of lockdown have been a battle for many young people. Teenagers in acute mental distress come to Le Domaine Hospital for psychiatric care, often after traumatic events or suicide attempts. Among the residents is this 17-year-old we're calling Alexandra.
COVID was an extra thing that just made me kind of collapse. It was the one thing of too much, too heavy. My dad is at high risk, so I had to be kind of isolated from my family. I had to eat by myself, stay by myself. I couldn't hug my parents.
Alexandra is not alone in struggling to cope with COVID, but she's one of those fortunate enough to access this hospital's help. Director Sophie Maas says new admission requests for troubled teens have skyrocketed since January. Maas thinks that's due to exhaustion, exam stress, and dashed hopes for a return to normality. Although makeshift rooms were added, there are no places left. And now, even the waiting list is closed.
How can you choose between a suicidal 15-year-old and a suicidal 16-year-old? It's impossible.
Dr. Maas believes authorities could save lives by prioritising teens as society reopens.
We need to create spaces for play, for joy and for conversation, so all young people can once again be part of the social fabric of life. Something so crucial for teenagers. If not, there's a real risk that mental health will keep deteriorating, and I'm truly afraid we'll see suicide rates increase. It feels like we're at the edge of a tsunami, and we urgently need to build flood defenses.
As the young people living here build up their emotional defences to re-enter the outside world, Alexandra hopes sharing her story will give strength to other teens who are suffering.
We're all struggling with the situation, but the fact that we're all still here and we're all still fighting against it is something very positive and something that will make us grow and we'll be able to look at after and say, wow, like I've went through these tough times, but I made it out.
Her priority is getting better as soon as she can, which could open the door for another young person who needs help.
Lisa Torell is an associate professor in psychology at the Karolinska Institute in Stockholm. 1 year into this pandemic, are you afraid the number of teens with mental health problems will keep rising?
Well, yes, I am. Our study was conducted already in May last year, and already then we could see quite severe effects on both children and their parents. And I think it's important to notice that although we examined the effects of homeschooling, I think that this was certainly not limited to just effects on the academics, but also on mental health issues.
So how has homeschooling affected the mental health of children and parents based on your studies?
Our study included about 7,000 ratings from parents on the effects on their own life and on their children's. And data was collected in 7 different European countries. And about 25 to 35% of the parents reported negative effects, severe negative effects, I would say, on their child's life. And as many as 35 to 55 of the parents reported negative effects on themselves. And with regard to the effects on the children, I think that a lot of children had really large problems carrying out homeschooling. There were really large demands on them on doing a lot of self-studies, and that increased their mental health problems. And parents also reported a lot of worrying and a lot of stress because they had to carry out most of the homeschooling with the children.
Yeah, well, apart from the extra work, the added stress, what about positives from your studies? I know I had a bit of a hard time at school and wouldn't have minded skipping the 2 buses and long walk to school as well.
Well, that is true. And actually, the transportation issue is something that a lot of parents are actually talking about, that saves time, that they don't have to travel to school, especially for the older children, which they might have a longer time to get to school and back. And that time can, of course, be spent on, for example, exercise and family time. So a lot of or not a lot, but some of the families are reporting, more family time. They do things together. They have lunch together. But that's, of course, dependent on if the parents are also at home and working, whereas we do have also a sub-study or a subgroup of children with mental health problems who are actually bullied in school and don't have a good social relationships with their peers. And they are, of course, also happy to be at home. So some of those kinds of positive effects can also be seen. But I should be careful and say that this is really a subgroup of people reporting the positive effects.
You said you talked to thousands of families. What were the most significant differences between countries?
Well, I think the largest differences between countries were actually in how homeschooling was carried out. And that, of course, also had effects on the negative and positive effects. So in general, we saw that a lot of the homeschooling was carried out as self-studies or in contact with a parent, and very little homeschooling was carried out as online teaching. But this really varied between countries. And in the UK and Germany, for example, about 5% of the time was spent on online teaching, whereas the corresponding numbers were about 25 to 30% in Sweden and Italy. So this was really had a huge effect, of course, on these families. This also resulted in large differences with regard to how much schooling the children actually did. In UK, for example, quite a lot of the children only got about 1 or 2 hours of schooling each day. And this was, of course, a huge difference compared to the children in, for example, Sweden, where they had a lot of online teaching.
And which children or adolescents would you say were affected or suffered most?
Well, we could see that to start with, we saw that the negative effects were larger for families having younger children. And also the children with mental health issues. So type of psychiatric disorders such as ADHD and autism, for example, we could see that those families with a child with that mental health problem, they were having more negative effects. They had really a lot of problems with getting the child to do their schooling, resulting in conflicts and things like that. And I also think that we've had effects on socioeconomic status. Unfortunately, our study was not so well equipped to investigate the effects of socioeconomics. Our sample was underrepresented in terms of both, immigrant background and low socioeconomic status. So I think actually we might have underestimated the negative effects in our study, and they were even greater.
So briefly, Lisa, what's the best way to educate kids in a pandemic?
Well, I think that we do need to do more online teaching, especially, even for younger children. I think it's doable. We have seen that some schools have been managing online teaching for young children as well. And I think it's really not possible for parents to take such a large responsibility in the homeschooling if we should have a well-functioning system. I also think it's important to take into account the new technologies that we have that we can use to make the teaching more adaptable and actually be adapted to the needs of the individual students. But this, of course, requires that we have, each student needs to have their own computer, they need to have a good internet connection, and they need to have a quiet place to sit and do their homeschooling. And this is, of course, not a reality for a lot of children in Europe today.
Not always a given. Lisa Terrell, thank you very much for being on the show today.
Thank you.
And for the last time this week, here's Derek Williams with another of our viewer questions.
Have we seen any impact on babies born from COVID-positive mothers?
I was really surprised just how complex this answer turned out to be and just how many issues are involved. The first is the breakdown of access in many places during the pandemic to routine prenatal care for expecting mothers. Now, that's definitely having a big impact on child health, though the one that's hard to quantify. The good news, the experts say, is that babies born to mothers infected with SARS-CoV-2 actually very rarely get severely ill themselves. And studies show that in general, the virus appears not to cross the placenta. However, they also show that pregnant women who catch COVID-19 are at more risk of developing severe forms of the disease. And now this is key, that an infection during pregnancy likely contributes to a higher risk of giving birth preterm. One estimate says COVID-19 in the mother makes preterm delivery 3 times more likely. And that's something that unquestionably has a negative impact on newborns. Preemies face a whole range of unique medical and development issues, many of which can be mitigated by a simple yet vital measure, which is skin-to-skin contact with parents. That's also known as kangaroo mother care. The problem is, because of the pandemic, babies are being separated from their infected mothers at alarming rates, supposedly to protect the child's health. But according to the WHO, that's doing actually a lot more damage than good. In a report published last week, it said the practice was putting newborn lives at risk in a big way and encouraged hospitals to allow mothers and babies to share rooms, even if the mother has an active COVID-19 infection. Because although it seems counterintuitive, kangaroo mother care will generally help the infant much more than a COVID-19 infection would hurt it.
Thank you, Derek. Thank you for watching and stay safe. I'll see you again soon. Bye-bye.